I'm Peter Kolker. Annie was my wife. We established the Ann Kolker Fellowship as a legacy for her after she passed away in 2016. Annie had been an advocate for women's health issues when she worked with the National Women's Center in the 1990s. She left the law center after she experienced ovarian cancer and realized that there was not an advocacy group for ovarian cancer patients comparable to the groups for breast cancer patients. So she formed the Ovarian Cancer National Alliance, and that group became an advocate for ovarian cancer patients and for women's health issues before the federal government and a number of federal agencies. We now have the opportunity to have the fellowship hosted by the National Women's Law Center. So it's a sort of a return to Annie's roots, and we are anxious to see others take up the work that she did, become advocates both for ovarian cancer patients and more broadly for women's health issues generally. And it's our hope that we will be able to foster career opportunities through the fellowship in the years to come.
Fellows have long been a really important part of how we achieve our impact, and we really value the work and the skills that they bring to our center as a whole. And we're really excited for the Kolker Fellow to fit in to our broader work. The Law Center is already really well known for its work to improve women's access to healthcare coverage and to improve the quality of care for women, especially women of color. Policymakers and other key stakeholders turn to us and they listen to us when we highlight a problem. They seek us out to work on solutions. And so that reputation and that trust and those relationships that we already have, combined with the subject matter and the work of the Kolker Fellow, means we really believe we can have an impact on the issue of gynecological cancers. So we are thrilled to house the Kolker Fellowship, and we are really pleased to have Erin here with us as our inaugural National Women's Law Center Kolker Fellow, leading the way for this new and exciting work going forward.
So tell me, Erin, about some of the work that you've been doing or some of the projects you've taken on.
As the Ann Kolker Fellow, I am very lucky and grateful that the majority of my attention is focused on gynecologic cancer issues. And that includes building relationships within the Law Center and externally to further this work. It's pretty special to be working at the Law Center on these issues because of the gender justice lens and being on the health equity team. We're always thinking about, which communities are being disproportionately impacted or underserved when it comes to health and health care. And we want to make sure that their experiences shape the conversation and the work that we're undertaking. So one project that is sort of the overarching project of this fellowship and is taking most of my time, is a project with community partners to address the disproportionate disease burden of endometrial cancer on Black endometrial cancer patients, or Black women primarily. And endometrial cancer is the most common gynecologic malignancy, yet there's still a lack of federally directed funding. And this is a disease where Black women are experiencing twice the mortality rate of other populations. So the goal of the product is for both the community partner to see their narratives reflected in the advocacy around gynecologic cancers, and to also provide specific legislative considerations and potential administrative actions that are critical to reducing these really awful statistics and to increase survivorship overall for endometrial cancer.
So how would you say that the Kolker Fellowship is preparing you for a career in patient advocacy or in women's health?
So NWC is an incredible place to learn. People are just experts on so many topics, reproductive justice, contraception, disability rights. They've been researching the gender wage gap for years. And there's just so much to be done for women's health and LGBTQ people's health. And it really takes people that are passionate and proactive. And I'm really seeing, good examples of what having a career in this space looks like. I'm working on not just, gynecologic cancer. I am getting to work on fact sheets and blogs and comments that relate to abortion and contraception and Medicaid. And so these are skills that I really think will allow me to develop a career in health equity policy and to work on women's health issues and LGBTQ people's issues.
Absolutely. That's amazing. And is there anything else that you would like to share with us?
I also want to say that one thing that is so exciting about the fellowship is that the work is really timely and responsive. There is still so much work to be done, like you mentioned about on gynecologic cancer and oncology care. There is such a lack of federal funding. There is a lack of federal research, federal funding towards providing care. And so this area of work is really exciting because what we're putting out there is new and original, and we're really adding value to the conversation. We're helping bringing people together, bringing community organizations together to work on reducing mortality, increasing survivorship, and to better the lives of women. So that's really exciting because this fellowship feels very, very timely and responsive.